Stem cells are your body's own natural healing cells. MaxStem is our simple, in-office procedure that helps your stem cells get right to the source of your pain so your body can repair itself.
So stem cell therapy, some people might think those are for only athletes because they heard about it in the news, like Kobe Bryant or Tiger Woods. Actually a lot of things that are, for those weekend warriors, people who just participate in sports from time to time, stem cell therapy is a great option for them, and especially with the technology that we bring and have in-house, we can actually make it available to everybody. You don't have to be famous, you don't have to be a high-performing athlete, you can just be somebody who has traditional knee pain. You might be someone who only exercises occasionally, or it might just be degenerative diseases where with time and wear and tear, your body's not functioning the way it should be, or it's hurting more. So that's where stem cell therapy is really great, is that it can be used for anybody who has pain or functional limitations.
My diagnosis was on my shoulder. I had a torn rotator cuff and a frozen shoulder. I couldn't not turn on a light switch. I could barely dress myself. I could barely tie my shoes. I could barely sleep. It was extremely painful. My aunt and my stepmother were patients, and when they found out I was coming to Florida for a visit, they both separately suggested I see Dr. Peretta. So I said, okay. And when I came, they retook x-rays, and Dr. Peretta examined me and said that I look like I'm a candidate for stem cell. I came in, they withdrew my blood, my bone marrow, which absolutely did not hurt. I was able to hold a conversation throughout the whole time, and put all the mixture together, and I proceeded to get the shots in my left shoulder. And the next day I started to move my shoulder, and within 3 to 4 days I started to do physical therapy. And I continued the physical therapy for, I would say, 2 to 3 weeks. And within that time, I was able to wash my own hair, to get dressed, to put on a light switch, and I never looked back. My quality of life now is, I would say, 100%. I was immobilized before Dr. Peretta. I could barely walk without the vibration of walking, excruciating pain on my left shoulder. That is how much I've improved. I lift weights, I do chin-ups, push-ups. I'm able to compete in any activity, sports that is of my choosing. I do climbing, hiking. To me, it's the most amazing thing I have ever seen in my life.
So the body can repair itself with stem cell treatments because your body naturally recruits stem cells or cell signaling in the body to help heal when you normally have injuries. In a lot of cases where patients are not healing properly, it's because they don't have enough healing capacity in that particular area. For example, in a knee joint with very severe osteoarthritis, or let's say a sports injury, a lot of times the body doesn't have enough resources or know to heal at that particular area of injury. When you utilize stem cell therapy, it actually is introducing factors such as growth factors, healing factors, anti-inflammatory factors even, to help stimulate a better environment so that the body can heal and repair some things that are going wrong, or at least not that, help reduce the pain, which is a large portion of patients I see who have a lot of pain and they want to feel better.
Well, the stem cell can heal a condition because this is the way nature intended it to work in the first place. Your stem cells are just basically following what nature taught them to do, to repair an injury and get it better.
I'm Bill Marshall. I'm a 55-year-old ex-college athlete. I've lived with pain for decades. My elbow, my knee, my shoulder. Thanks to Stem Cell Centers of America, I'm now going back to the things that I love to do. Soccer, golf, surfing. Pain-free. Stem Cell Centers of America worked for me. They can work for you.
Areas of the body that typically respond well to stem cell therapy are joints. For example, knee joints, hip joints, shoulder joints. You can also treat the smaller joints, but the large joints actually do very well. And being that a large amount of patients have knee problems, that's one of the favorite joints that I like to treat. You know, stem cell therapy can also be used in certain cases for the spine. It just depends on the medical condition and the reason why they have pain. But joints are very good and excellent candidates for people to come in for therapy.
The pain in my knee is gone now, and there isn't anything I can't do now. In fact, my son and I, we just climbed Mount Kilimanjaro.
This is exactly what we do. The body has treasure troves of stem cells. However, it cannot access these cells. Now, we make it so the body can access these cells by harvesting them and then putting them in areas where they're needed, where the body typically would not put them on its own.
For stem cell treatment, people might wonder, am I too old for therapy? And really the answer is no. I mean, in general, stem cell therapy can be used on almost anyone from any age range. I mean, in particular, especially for some of the older patients who might be surgical candidates, but maybe the risk outweighs the benefits. So those actually are really good candidates for stem cell therapy, is especially when there's a high risk for surgery and it's really not going to be that much more beneficial.
As we age, our stem cells get caught and trapped in certain areas. And one of the skills that we do is to take these trapped stem cells and utilize them to repair injuries that normally would not be repaired by the body. This is the whole secret of what we do.
I think stem cell therapy treatment can be considered any time the patient's not really getting the results that they want with their current medical condition or the doctors they've been seeing. I think anytime a patient's offered surgery, they should also consider stem cell therapy, because a lot of times when they see a surgeon, that's his goal. I mean, his goal is to operate and to be a surgeon, which is fine, but with our modern technology, we actually have situations where you can avoid a surgery. And I think that's the best case where people can really benefit from stem cell therapy. When you have pain, number one, number two, limitation in range of motion or function, and three, perhaps you don't want to have surgery. I think those are three really great options for people to consider stem cell therapy.
My pain is gone.
And I have my husband back.
I'm walking without my cane. I'm going upstairs easily. I'm even dancing with my wife again.
Downtime for stem cell procedures can vary from patient to patient. Typically, most people experience stiffness for the first few days. Maybe for a week, that stiffness may start to resolve. Overall, it's all injection-based therapy, so these type of therapies are very minimally invasive with lower risk than traditional surgery. So recovery is much faster when you compare the two.
My diagnosis was a severely torn rotator cuff and some osteoarthritis in my shoulder. And I've had severe osteoarthritis in my hips and my knees, and both hips and both knees have been replaced. And I was looking at surgery to correct this when I heard about Dr. Parita's stem cell therapy. You know, once we came in to his office, we met a lot of other people waiting, and their stories were just phenomenal. So I said, well, this is worth giving it a try. I don't care what it costs. You know, I'd rather not go under the knife again than have another artificial part in my body that eventually will wear out. Hopefully not before I do, but you never know. The treatment I received from Dr. Parita really consisted of 4 injections in the affected area. The injections were preceded by the extraction of stem cells from bone marrow, from fat cells, and from just your blood. It's been about a year now, year and a half, since I had that procedure done. It took roughly 16, 18 weeks to go through the whole thing. And now I have full motion of my shoulder and my arm. I could couldn't do anywhere near this before. I couldn't go behind my back. I couldn't go up like this. I mean, I didn't have the rotating ability. It was tremendous pain when I did that. And now I have absolutely full use of it without surgery. No scars here.
The body repairs itself with our treatment, much like the body's been doing since the beginning of time. Stem cells have always healed things. Like I say, cells, not doctors, heal patients. And the problem we've had is as we get older, the amount of damage many times exceeds the amount of repair. So we try and help that along. I kind of liken stem cells that we put into an area sort of like a Navy SEAL strike team. They go in there, they go into a very hostile area, they try and prepare that area so then that the body can go ahead and do the final thing. The cells that we put in there are not what actually does the ultimate result. The cells can prepare the area, but the body has to keep sending in cells to make things happen and make things work. You know, the stem cell therapy in today's world is somewhat confusing. I mean, I have a saying, when you look at a website and that website says they treat this, they treat that, they treat Alzheimer's, they treat Parkinson's, they treat ALS. When you treat many things, you treat nothing. Because you can't treat all these things. You can't be an expert in all these things. We pride ourselves in basically treating musculoskeletal problems. I'm an orthopedic surgeon, been one 35 years, so I know orthopedics and I know what sort of works and what doesn't work. And this is what we're attempting to accomplish. You can't, and we never cure anything. We get things better, but we don't cure things.
I had a torn ACL in my right knee, and I had severe arthritis comparable to that of a 70-year-old man. I was told that at age 54 they'd never seen so much arthritis in my right knee, and believe me, I felt it too. Prior to the stem cell treatment, I had 2 failed arthroscopic surgeries in that right knee, and the second one was done 3 months after the first with no positive results whatsoever, no change, no difference. Then by sheer coincidence, I found out about Dr. Parita and his stem cell therapy and thought, what the heck, I have nothing to lose. So I was in so much pain and I was basically disabled. I had gained weight, was weighing upwards of 260 pounds, was depressed, and I'm a very active individual and could not do the things I needed or wanted to do. So I took a chance and met Dr. Parita, had some x-rays done, and then began the treatment. And once the treatment was over, I got a new lease on life. That was 4 years ago, and to this day I hunt, I hike in the Everglades, I canoe, I climb trees, I ride my bicycle 15 miles a day, every day. The other story, it's not about me, it's about my mom. My mom is 81 years old right now. I brought her to Dr. Parita, I think 2.5 years ago. They told her she needed a right knee replacement. I told my mom, All of her friends that have had knee replacements are walking like semi-cripples today, in pain, and some of them with canes, needing assistance, and others just in constant discomfort. I told my mom, no. I said, as a last resort, we'll consider it. Let's go to Dr. Parita first. He treated my mom. My mom is fine right now. If she can do it at 78, 79 years of age, if her body can respond to the treatments at that age, then the treatment works, okay? Because the body at that time usually is slower to heal, if it'll heal at all in some cases. And she's doing great. I got my life back. Yeah, I got my life back. And that is exactly the way I would define it.
The
pain in my hip and knee used to be so severe that I needed a cane just to walk.
We thought he was going to need surgery.
But we found a better solution.
At Stem Cell Centers of America, our state-of-the-art MaxStem procedure allows us to transfer stored stem cells from your own body directly to the source of your pain and discomfort, allowing your joints to repair themselves without invasive surgery.
Stem cells are your body's own natural healing cells. MaxStem is our simple in-office procedure that helps your stem cells get right to the source of your pain so your body can actually repair itself.
Call now to schedule a free consultation with one of our specialists and receive a free review of your X-ray or MRI.
My pain is gone.
And I have my husband back.
I'm walking without my cane. I'm going upstairs easily, and I'm even dancing with my wife again.
Call now to schedule your free consultation and learn how you can benefit from MaxStem. Call now.
Testimonials are pretty good, and it's really heartening when you see somebody who couldn't do something and now they're going back and doing it. I mean, I see a lot of pro athletes that we've treated that we don't like to mention, but you see him, on a Sunday or something playing, you say, aha, there's my guy. I've told some of these guys, I said, listen, I'm a Dolphin fan. Make sure you take it easy when you play the Dolphins, though. I sort of feel bad, especially, I've had one guy once made a couple tackles on the quarterback, and I said, oh, God, how could I have done that? But, you sort of feel good even though you feel bad.
My diagnosis was that I would have to have a hip replacement. And I was very taken aback by that. So a friend of mine said to me, you don't need to do that. You can have a stem cell replacement. I said, really? So tell me about it. She gave me a little information. I went online and I discovered Dr. Joseph Parita. One of the doctors said to me, listen, I'm only an hour across from you, right across Alligator Alley. I'd love to see you. I said, well, actually, sorry, I actually have an appointment, coming up on Friday. He said, may I ask where you're going? And I said, well, I'm going up to Boca Raton. He said, would you mind if I ask you who you're going to see? I said, well, I'm going to see Dr. Parita. He said, Joseph Parita? I said, yes, and I kind of went back a second, and I said, yes, Joseph Parita. He said, hang up with me right now. Go and see him tomorrow morning. He is the best in the world. I came home, he said, you'll expect to be added for about 10 days conservatively. Well, I'll tell you the truth. By the third day, I was driving my car with the foot, with the hip. It is incredible. It is incredible. And I'm 69, and I could raise my leg and to the up, to the side, to the back. I'm good to go. I'm good to go. I'd give you a demonstration, but I don't know how that would look on tape. It's like I'm brand new. There's no other way to explain that. I can do everything I've done before. It made like it never happened. Made like the hip injury that was just time and tide was gone. Was gone. And I'm all better. And I'm running around like a chicken without a head, and he has to yell at me to slow down.
I love to hike and bike with my family, but my knee pain really limited what I could do. I was told I needed surgery, but I found a much better solution.
At Stem Cell Centers of America, our state-of-the-art MaxStem procedure allows us to transfer stored stem cells from your own body directly to the source of your pain and discomfort, allowing your joints to repair themselves without invasive surgery.
Stem cells are your body's own natural healing cells. MaxStem is our simple in-office procedure that helps your stem cells get right to the source of your pain so your body can actually repair itself.
Call now or go to maxstem.com to schedule a free consultation with one of our specialists and receive a free review of your X-ray or MRI.
The pain in my knee is gone, and there isn't anything I can't do now. In fact, my son and I, we just climbed Mount Kilimanjaro.
Call now to schedule your free consultation and learn how you can benefit from MaxStem. Call now.
I've always been interested in the cutting edge ever since I was a resident. When I was a resident, we were doing cases with collagenase, which was an enzyme. We were putting it into a herniated disc and dissolving the disc. And this has always been something that's fascinated me. In other words, I've always been somebody, I didn't know what it was at the time, but it was regenerative medicine. In other words, it was the cutting edge of the cutting edge, the far out stuff. You had to think outside the box. That intrigues me, and that's what this field is, thinking outside the box and making it come back into the box. You know, I think this is my baby now. This is why I'm really into this, and I love getting on the cutting edge of the cutting edge. And what's interesting is I'm meeting people all over the world. I can go to countries now. I could go stay with somebody for 2 or 3 weeks and stay with a different person, you know, and developing kinships. I mean, good friends in Australia, good friends in the Philippines, China, South America, Europe, other parts of Asia. I mean, it's like an amazing thing where you can go and talk to these people, and you really can kind of, it's kind of getting rid of boundaries. You know, we're not talking politics. Yes, there's some politics in this field, but it's not the politics like we have the politics in the world. I mean, here we all get together with one common goal, to advance the science.
The pain in my hip used to keep me from getting out and enjoying life.
We were told she needed surgery.
But I found a much better solution.
At Stem Cell Centers of America, our state-of-the-art MaxStem procedure allows us to transfer stored stem cells from your own body directly to the source of your pain and discomfort, allowing your joints to repair themselves without invasive surgery.
Stem cells are your body's own natural healing cells. MaxStem is our simple in-office procedure that helps your stem cells get right to the source of your pain so your body can actually repair itself.
Call now or go to maxstem.com to schedule a free consultation with one of our specialists and receive a free review of your X-ray or MRI.
Thanks to Stem Cell Centers of America, that horrible pain in my hip is gone, and I'm living life again to the fullest.
Call now to schedule your free consultation and learn how you can benefit from MaxStem. Call now.
Well, I've been an orthopedic surgeon for about 35 years here in Boca Raton, Florida. I trained at the University of Miami, did my orthopedic residency. My college and medical school training was at Georgetown University in Washington, D.C. And I've been in the same locale for, like I say, 35 years. We just moved to this particular facility because we felt that in order to really give stem cell treatments the proper way, we had to have a state-of-the-art facility, and that's what I believe we have. If you're going to treat musculoskeletal problems, you need to have a specialist who's familiar with those problems. I spent 4 years of intensive training learning about every joint in the body, learning about all the afflictions of the joints, and learning how to approach them surgically. So that background, I think, gives me a distinct advantage over most everyone else in this field. I mean, if you have an anesthesiologist or you have a family practitioner or a physiatrist, they don't have the nuances of how to treat injuries like this. They've never been in an OR setting. They don't really know what's proper and what's not. I can wear two hats. I can wear the hat as an orthopedic surgeon. I can wear the hat of a regenerative medicine doctor. My experience with stem cell cases dates back for about 12 years now. I've done thousands of cases, and I use my knowledge as an orthopedic surgeon to expand upon this, and I'm always looking to push the envelope, always looking for the next cutting edge of the cutting edge. So my experience is hips, knees, shoulders, spine, you name it. If it's orthopedic, I treat it. Well, to say what kind of treatment I've done and what kind of things I've done is basically to say what's involved in orthopedics. Orthopedics is the specialty that involves the extremities and the spine. So if it's part of the extremities or it's part of the spine, I've taken care of it. But let me take it one step further. I also deal with some autoimmune diseases such as rheumatoid arthritis and things like that, where we'll give the V cells to. I'm also very interested in anti-aging medicine because stem cells and aging go hand in hand with the immune system. So I have to kind of learn about those things also. So we're dealing with all those things. So bottom line is, if it's in the extremities, if it's in the spine, if it's in the anti-aging field or autoimmune field, I treat it. You know, a question people say is, Well, you think it's good to use my own stem cells since they may be old. Well, all well and good. You may hear these stories from other entities saying you don't want to use your own stem cells because they're old. You want to use the stem cells from the placenta tissue, from the cord blood, from the amniotic tissue. There's one big problem with that. The FDA does not allow live cells in those products. So you're only getting growth factors only. There's nothing like your own cells. The other good news about using your own cells, there's no chance of an allergic reaction. These other entities always have the potential of causing an allergic reaction. They are not what we call immune privilege, meaning immune privilege means it can be used in anyone. They're what we call immune evasive. They kind of fool the body for a while, but eventually the body catches up with them. There's nothing as good as your own cells. The type of stem cells that we use sort of depends somewhat on the patient's condition. The minimum that we'll use is what we call a PRP, which are the growth factors from the blood, and fat, which has some purposes of cushioning the joint and supporting the joint, but it also has some stem cells in it also. Now, if I have a joint that's bone-on-bone arthritis or something, then I'm going to basically go to the ultimate. I'm going to use cells from the bone marrow, cells from the fat, and cells from the PRP, and I'm going to follow that up with a couple of booster injections of cells from the PRP and growth factors from the PRP. So people ask me, okay, so you're not much different than the guy down the street in that he's going to also use my bone marrow and my fat and my blood. Yes, but there's a lot of different things. We also are going to maybe use shockwave therapy. It's called extracorporeal shockwave therapy, which is more like a jackhammer. It's nothing to do really with electricity. That's something most people don't have access to. More importantly, we'll have access to growth factors. You know, stem cells, and the reason why we get into trouble with stem cells and treatments is our stem cells don't necessarily make the right growth factors. We enhance this by using patches with growth factors. The most unique process around. There's only 2 or 3 places in the whole world where these are available, and these are places that I work at. Well, you should choose me if you want to have the best possible result. I mean, there's no guarantees. I may do you and you still may not get better, but I can pretty well tell you, I think I'm going to give you a better chance of getting better than the average guy out there. I don't dabble in this. I devote myself fully to it. I work in my office every day, except weekends. But on weekends, I'm reading and I'm studying. I'm preparing for lectures that I'm going to give to other doctors. So I'm always trying to, again, be on the cutting edge of the cutting edge. I don't think these other people can say it. They're followers. I'm a leader. Well, for a lot of them, they think it's a very easy field and a lucrative field for them. Unfortunately, I think they've put the well-being of the patient in the back seat. Their knowledge of stem cells is really limited. Again, I see this all the time and I just shake my head. But like I say, it's a field for them. They think it's an easy thing to do. This is a very hard field. If you're going to do it and do it right, it's going to take many years to learn, and you have to always keep wanting to learn. You don't want to just do something that's very simple. I've always, ever since I've been a resident, been interested in the cutting edge. I get bored. I guess I have some ADD. I've always known that ever since I was a child, and things bore me. But this is a field that doesn't bore me because there's always something new right around the corner, something that's intriguing, something that I think I can make better. You know, like I say, now I'm getting really involved in anti-aging. I think we're going to make some tremendous differences in that, and it's going to make a difference and a mark on the world. In some respects, stem cells are too good to be true. The problem that we've run into stem cells, and I have a saying when I tell people, I said, if you see a website that's treating everything, that means they're treating nothing, okay? As far as stem cells are concerned, we've probably made more strides in the field of musculoskeletal conditions than anything else. But when you start treating Parkinson's, or you start treating Alzheimer's or ALS, I'm not so sure the promise is there yet. I think there is some good benefits that can be attained down the road, but we're not there yet. So the promise is there, but it's not necessarily yet attainable. This is a very simple thing, and I'd like to get a little technical on this. To register these products with the FDA is a very easy application. It's called a 361. But what they're doing is they're registering only as a tissue product. The FDA is okay with that. But the FDA is very specific, saying that if your tissue product by some chance contains live cells that have metabolic activity, this is no longer a 361. It's now classified as what they call a 351. A 351 requires what they call an investigational new drug application, meaning that it has to undergo clinical research, clinical trials, and many years of evaluation. Then it may be approved by the FDA. So if someone is saying that they're giving live cells with these products, they basically, it's one of two things. Either the doctor has been hoodwinked by a slick salesman, or the doctor's dishonest. I'm hoping he's been hoodwinked. The minimum qualifications should be, you need to be qualified first. I'm board certified in orthopedic surgery. I know joints in and out, forward and backwards. Like I say, orthopedics is a study of the spine and the extremities. You would not have to have a doctor, or nor want a doctor, treating you who's not really specialized in training of those entities. All these other physicians may have had bits and pieces of it in their training, but not 4 years straight of it like I have. So to me, right off the bat, you need to be an orthopedic surgeon to be proficient in these things, and then you need to know stem cells. So you need to wear two hats, regenerative medicine and stem cells. So you need to ask the doctor, basically, what are your qualifications? How long have you been doing this? How many cases have been done? Am I going to have a doctor who's going to inject me, or is it going to be a nurse practitioner? Are you going to use imaging, either a fluoroscope or an ultrasound or both? Is it going to be done the proper way? What cells are you going to use? How are you going to use them? Stem cell therapy, I think, is the answer to most diseases, answer to anti-aging. If I can kind of increase my quality of life, you know, we can live longer, but if we can't live longer with a good quality of life, then it's not worth living. So I think there's a lot of things that we're going to do. It's going to revolutionize medicine. It's already doing that, and it's just going to continue. The genie is out of the bottle, and luckily it's going to stay out of the bottle.